participating in Dr. Sheng-Po Hao retirement virtual webinar. Today, we're really honored to have Dr. Narmaya Thapa for today's online lecture. Dr. Narmaya finished her fellowship and training in the field of endoscopic sinus surgery, rhinoplasty, and facial plastic surgery in India, South Korea, Australia, and UK. She received an award for the Best Doctor in 20th anniversary of Tribhuvan University Teaching Hospital in 2007. She also attended many international congresses and workshops as an international faculty and more than 20 guest paper presentations. She's now the professor of the Department of ENT Head and Neck Surgery in Tribhuvan University Teaching Hospital in Nepal. She's also the president of SAARC Otolaryngology Association. Let's give a warm welcome to Dr. Narmaya for today's lecture.
Thank you, Dr. Go, for a wonderful introduction of mine. Very warm good morning, good afternoon, and good evening, everyone. So first of all, I'd like to thank Professor Sheng-Po Hao and whole team for organizing such a wonderful academic program, retirement webinar. I think this is the first its kind in the world at till date. And I also like to congratulate Professor Hao and express best wishes for his retirement life. Since I met Professor Hao, I have found him a very energetic academician and leader, but not only that, I have found him a very good guardian, especially for us who always encourages to be active and energetic in our field. Without delay, I'd like to start my talk. We choose this topic because the disease patterns and healthcare system may be quite different between developing countries like ours and developed countries. So I'd like to start from introduction. This is my hospital, Tribhuvan University Teaching Hospital. Is the pioneer university hospital in Nepal. This is ENT building. First 2 floors is occupied by ENT, upper 2 floors occupied by orthopedics department. Next slide, please. Next slide. Yeah. Next one. Yeah. So I also like to acknowledge authors from whom I have taken some references, my patients with photos I have taken and kept in this presentation, and my colleagues, and there's no conflict of interest. Next, please. Next. Yes. I have met Professor Hao in Hyderabad and also in Seoul in 2018 and 19, and in 2023 in Australia, Brisbane, during Asia Oceania Conference. Next, please. Yeah. Let me introduce my country, Nepal. Nepal is a small landlocked country situated between giant countries like India and China. It occupies 147,000 square kilometers, and it is divided into 3 regions geographically. The southern part is plain area, that is Tarai, is connected to India, and middle part is occupied by hills, and the northern part, in northern part there are mountains, high mountains, including Mount Everest, and out of 12 highest mountains in the world, 8 highest mountains are in Nepal, and it has got about 30 million population. Next, please.
Next.
Yeah. Now, let's see some key indicators. Average life expectancy of Nepalese people are 71 years, little bit higher in female. Population growth rate is 1.85%, and per capita income is around $1,200. Adult literacy rate is 67.9%, and about 18% people they live below poverty line, and 80% people live in rural areas. Next, please. And average family size is 4.6 number. And about 70% people, they use firewood, cattle dung, agro waste as cooking fuel. Still they use like that. Regarding burden of ENT diseases, according to a study done by Apr et al. In western part of Nepal, in government school, they found 49% ENT disorders. Out of this, commonest was ear disease. It was about 35%. And another study, it was also done in rural area of western part of Nepal. They found 74% ear disease, throat problem in 13%, and nasal problem in 12%. And chronic otitis media mucosal type was the most prevalent disease. Another study done in a large population presented in OPD of a tertiary care center hospital of western part of Nepal found they found 24% children, and they have 77% ear problem, 13% throat problem, and 9% nasal problem. Next, please. Now, why are ENT disease common in Nepal? There is low socioeconomic status. So many people, as I have mentioned, they stay in rural areas, and many people they stay in this type of house in a hut, and they use cow dungs for cooking, and they use firewood, and they have to rely on donkeys to carry their necessary things. And this gentleman is carrying a refrigerator for a oil post in a remote area to preserve vaccines. And the many children, school-going children, they use this type of rope to go to school every day. And there are poor hygiene, also smoking habit, and there is lack of health facility here. They have to carry sick people on the back with this type of this is ambulance in rural areas, or they have to, if they can afford, they have to use helicopter. Next, please. There are some ritual or social customs, stigmas, and habits. Let's see this picture. After giving birth, they use oil not only in the whole body. They put oil in the ear, also in eyes, and they use this kind of materials or things to remove wax or to pick ear. Even in urban areas, in cities, they use this kind of ear bud to clean their ear. And smoking habit, I have already mentioned. And they have nose blowing habits as well. There are many stigmas and habits. They lead to ENT problems. Next, please. Now, who are providing ENT services in Nepal? Besides Nepal government, Ministry of Health. There are some private hospitals. There are many private hospitals, but limited to, they are mainly limited in the cities, and semi-government hospitals like university hospitals. There are 8 number. Organization, various NGOs, INGOs are working, and cooperative hospitals also. They are serving ENT services. Now, the level of health institutions has been categorized into different levels. The level 1 is community level, that is health post or community health units are included in it. Primary hospitals have been divided into sub-metropolitan or metropolitan, city and rural municipality. And secondary hospitals include provincial health science academy, ENT services, particularly ENT surgeries are done only in this level, from this level only. And tertiary hospitals, they are federal level, and academic or super specialty hospitals, like there are some cancer centers, transplant centers, and neuro centers as well. Next, please. Now, these hospitals and health posts have been under different government, like primary health post, community health units, urban health centers are under local government, and provincial academic hospitals and secondary hospitals are under provincial Ministry of Health, and federal academic hospitals, super specialty hospitals are under Federal Ministry of Health. Next, please. Now, there are various academic institutes. Some are under government, some are private. The Tribhuvan University is the pioneer university of Nepal, under which there is Institute of Medicine, and our institute, our college, Maharajganj Medical College, is under the Institute of Medicine. There are other private affiliated colleges under this institute. Similarly, there are other institutes, the medical institutes. Kathmandu University is private institute. Under this, there is Kathmandu University Medical Science, and there are other affiliated colleges as well. Next, please. Now, organizations, that means NGOs, INGOs working in Nepal, they are doing tremendous job. Particularly, they are focusing on prevention of deafness, like Impact Nepal, WHO, Air Care Nepal, Air Aid Nepal, that is INF in Pokhara, Brinos in Nepalganj, Shol Nepal, CBM, Shruti Foundation, Karuna Foundation, Cheers, SAN, that is this is audiology and speech language pathology society, and Singh, this cochlear implant group Nepal, and CBR Bhaktapur. They are working in various parts of Nepal. Next, please. Now, let's see about National Health Insurance Policy. This policy had passed, this act has been passed in 2014 and was implemented in 3 districts in 2016. Till now, it has been implemented in 27 government hospitals. The family have to pay up to 35 USD per year for up to 5 members, and they have to add 7 USD for every additional family member. This is for a year. And there is 100% subsidy for families of ultra poor, HIV, multi-drug resistant tuberculosis, leprosy, severe disability patients. And there is 100% subsidy for elderly population above 70 years. But this facility has been limited to certain or limited medicines and common surgeries only, and it has not reached up to grassroots level treatment. Next, please. This is my father's card. Uh, this, there are some other medical facilities like for cancer treatment, they get from government about 750 USD, and for cochlear implantation, government has provided $4,850 for a patient. Next, please. Now, regarding cost of common ENT surgeries like septoplasty, tonsillectomy, we are very commonly done. In government hospital, patients have to pay up to 75 USD in an average. This is an average. And for in government, semi-government hospital, they have to pay 134 USD. In corporate hospitals, it's 300 USD. And in private hospital, 600 USD. This is an average cost of surgeries. Next, please. Now, regarding human resources, there are 241 registered doctors in ENT society, about 25 to 30, they haven't registered yet. And audiologists and speech language pathologists, they are 92 registered in their society, but only 52 are working. Others have left the country to go abroad. And others who are also providing services are audiometricians, health assistant, community medicine assistants, primary health care workers, and also GPs are providing services. Next, please. Now, what are common surgeries we do here in Nepal? In otology, meryngoplasty, radical mastoid surgery, in modified radical surgery, mastoid surgery, in head and neck, mastoidectomy, in head and neck, thyroidectomy, tonsillectomy, in rhinology, septoplasty, endoscopic sinus surgery, in pediatric, adenotonsillectomy are the common surgeries we do here. Next, please. Now, special ENT surgeries also being done in certain areas, especially in tertiary care center like ours. Like in otology, we are doing cochlear implantation, lateral skull base surgery, in head and neck, some head and neck malignancies with distant flap reconstruction, in rhinology, CHF leak repair, DRAP 1 and 2, rhinoplasty, local flaps for facial defects, and in pediatrics, pediatric airway surgery and sleep surgeries also being done. Next, please. Next, please. Now, let me tell something about our society, Society of Otolaryngologists of Nepal. It was established in 1998 with 7 members. And since the beginning, it has been doing working very actively. We organize CME in quarterly, and we have published ENT manual for paramedics, ENT health manual for secondary level school teachers and community health volunteers. And we have published peer-reviewed journal, sorry, there is mistake, biannually. And next, please. We organize a national congress in every 2 years, when we have organized 3 international congress, that is SAC ENT Congress so far. Now, yeah. During COVID, we have done many works like awareness. We have awareness webinars, and we prepared safety guidelines for ENT surgeons and general publics. And we prepared informed consent for common ENT surgeries and distributed all over the country. And we also prepared advisory for the prevention and treatment of mucormycosis. And we organized some awareness program during an occasion of World Hearing Day or World Cancer Day, etc. Next, please. And our members have participated in free ear surgical camps organized by various organizations. And during COVID time, we organized 18 webinars. Next, please. There are some of the pictures of celebrating World Hearing Day in 2020, 2021, 2022, 2023 also. Sorry, there is some mistake. Please, next, please. Next, please. Yeah, these are some glimpses of webinars we organized. Next, please. Now, let me tell you something about Department of ENT and Diagnostic Surgery. Our department, our department is one of the largest department in Tribhuvan University Teaching Hospital, which is the pioneer medical university. And we have 5 units. That in unit 1, that is otology, neurotology. We have 3 faculties, head and neck and reconstructive surgery. In this also, we have 3 faculties, pediatric, ORL, airway and sleep disorder unit. Here we have 3 faculties. In rhinology, anti-skull base, facial plastic surgery, we are 4 faculties. In audiology, speech language pathology, there are 4 academic and 3 clinical staffs. Next, please. Now, yes, for last many years, we are organizing many programs regarding academic courses. We have masters in ORL, which was recognized by MCI, that is Medical Council of India. Our department was the first department which was recognized by Medical Council of India. And besides this, we run MBBS and BSLP programs. We conduct various training programs for HAs and CMS and for audiometric assistants. And yearly, we conduct temporal bone hands and dissection course, endoscopic sinus surgery and facial plastic workshop. Similarly, head and neck, cadaver, hands-on workshop, and pediatric airway workshops. Next, please. Now, let me tell you something about services provided by our department. In OPD, every month, we examine about 7,000 patients, around 4,000 new patients, and 3,000 old patients. And we do this flexible nasopharyngeal laryngoscopy every day of 35 to 40 patients. And we have skin prick test. In OT, we operate around 160 patients every month, routinely 143, this is in average, and about 14 to 16 emergency surgeries. In the ward, we have 43 beds and 1 sleep lab. In SLP, we do OE, ABR, we have vestibular lab. Similarly, we are conducting newborn hearing screening, that is universal newborn hearing screening, and we have auditory verbal therapy lab. Next, please. Now, we have, despite of increasing number of hospitals and specialists, we have number of patients increasing every year, and the waiting list is at least for 6 months for OT. Patients have to wait at least for 6 months for surgery. and there is lack of awareness, health facilities. Patients come very in advanced stage like this. This see a maxilla of right side had come involving orbit and cheek skin as well. And there is inadequate or old equipments and the limited resources as well. Next, please. Despite of this, Nepal is full of natural resources and cultural heritage, the highest mountains I have already mentioned, and beautiful places like Pokhara, and there are jungle safaris. You can ride elephants and see tigers, rhinos, and you can have trekking. There are beautiful trekking routes, best trekking routes in Nepal. And we can visit Lumini, where Lord Gautam Buddha was born. And please come to Nepal. I would like to welcome you all. Thank you for your kind attention. And this time we have the hill forests are full of rhododendron. We can see everywhere rhododendron blooming. Please visit, especially this season is the best season. Thank you so much.
Thank you, Dr. Narmaya. It looks really attractive to go to Nepal for visiting. I hope I can go someday. So now let's open to the floor. Is there any question from the audience? Dr. Narmaya, I have one question from myself.
Yes.
I was quite surprising to find that there's a high prevalence of ear disease in your country. It sounds like that ear disease comprised almost 70% of the ENT disease in Nepal, and you just explained that that could be due to the ear picking habits in your country, and also when they give birth to newborn, they have the oil all over the body of the newborn and also the ear. And that could be one of the reasons to have the high prevalence of ear disease. But is there any other reasons, for example, due to the lower prevalence of antibiotic usage or something, or any other reason to make the high prevalence of ear disease in your country? Because that is quite different in our practice.
As Dr. Kaur, they also have nose problem. Until and unless they have severe problem, they don't visit hospitals or clinicians. They use local herbal medicines. And unless and until they have advanced like severe earache, severe complications, they don't visit hospital. One is that. Another is I just forgot to mention that they take bath in dirty ponds, dirty rivers. That is another problem. Yes.
Thank you. So is there any question? If there's no any other question, that's it's time to Dr. Sheng-Po Hao.
Maybe we go back to Narmaya. I think this is a wonderful, lecture, and you certainly allow us to know better what happened in Nepal. And I just want to go back to the last slide, the challenges. So increasing number of patients despite of increasing number of hospital and specialists, and very, very long waiting list, and lack of awareness health facilities, and inadequate equipment, and limited resources. I think this might happen also in old days of Taiwan. We all passed this period. Well, as from a developing country or to a developed country, we all pass this. So I could imagine how difficult the difficulties for you to practice in Nepal. So I have to congratulate you and your colleagues. You really did a great job to take care of your people in such a difficult environment and difficult condition. And please tell me, there are so many challenges. And would you please just number what's the most important to you, and what's the second, and what's the third? Can you just number the must solved problem, which is the number one, and number two, and number three?
Thank you, sir. I think the number one problem is infrastructure. We have we don't have roads, good roads. People have to carry porters and donkeys. They have to use donkeys, and porters have to carry things for even for their daily uses. Yeah, and that is one. Number two is the awareness. Education. There's lack of education as well. We have to focus on education from the beginning, from school, and also for general public also. And also we have equipments. That is another problem. We are using equipments for last 15 years, same equipments for last 15 or 20 years actually, even in our hospital. But in periphery, though they are hospitals, they don't have equipments. If ENT surgeon, ENT doctor goes there to work, they will be ENT physicians. They will just examine the patient. They can do very simple surgeries, and they have to refer patients to the higher centers. That is another problem.
Thank you. And please allow me to ask further, if telemedicine possible in Nepal?
It was proposed, sir, but it has not been implemented yet.
And can you train some, in rural area, do we have public health nurse or public health, specialist in the rural area to help you to make the basic diagnosis, and then probably transfer and with telemedicine and seek of, support from the center? Is it possible to have public health nurse in the rural area?
We have. So actually, we don't have public health nurse. There are nurses and it's anommies. Anommies are just trained nurses, not like a 3 years study, only 1 year. They have done 1 year training like that. And we have HAs, CMAs, health assistant, and community medical auxiliaries or work assistants. We give training to them. And the NGOs also, like Brinos, like Impact Nepal, like Cheers, they are also giving training to them, but mainly focusing on ear disease.
Yeah, very good. Thank you. Thank you so much. Yeah.
Thank you very much, sir. Thank you.
Yeah, I think it would be very difficult. Sometimes it's difficult for us to really imagine how difficult your practice in Nepal, in some area or some other part of the world, like Palau. Because our hospital has been supporting Palau health, or and then actually all the Palau patient, serious disease, they all sent to us in Taiwan, and we take care of them. And so, but I guess like ENT otolaryngology, it's a very special service. So, and only for a small group of people. So that's probably the best way to solve the problem. Maybe just to train a certain specialist or and if the ear disease is most common in Nepal, probably, and you are lack of audiologist, maybe we could afford you some opportunities and then try to train some audiologists, and then and try to support you. That's what I can think of now. And so definitely congratulate you. And I have to, say that I'm really very, very, proud of you as being your friends, and I really love to work with you and try to bring help on and support to you and of course your colleagues and the country. Thank you
Thank
so
you
much.
very much, sir. I'll talk to my colleagues about this. Definitely. Thank you, sir. Thank you so much.
Okay, thank you, Dr. Narmaya, for your inspiring talk. And let's switch the slide to the yeah. There's also some other webinar. So Dr. Sheng-Po Hao would like to introduce the rest of the.
Yeah, so thank you, Dr. Go, for your moderating the section, and certainly Professor Narmaya gave a wonderful lecture and allowing us to better understand of what's happening in Nepal. And if anybody loves to know better what's happening in Nepal, or you want to help, please contact me or contact Professor Narmaya. And then just a little broadcast. Next week, next Monday, we are going to invite Professor Wojciech Goludzinski from Poland, and he is working in the European Head and Neck Society and a very important person in Europe, and he is talking about the basic research in the field of head and neck surgery, connection between the hospital bed and the job. So from the bench to the ward. And then the last will be, in this month, will be our friend, Dr. Alfredo Pontejo's a classification of neck dissection, a better one. So love to see everyone next Monday. So thank you for sharing with us your experience, Professor Narmaya. And I know it's very early in Nepal. And, do you have breakfast already?
Not yet, sir. Now I will have.
And so
now
hope you have
I have
a
to
great
prepare.
day.
Yes,
Yeah.
sir. Thank you very much. Thank you for organizing such a nice program, sir. Actually, it's a wonderful program, actually. So I try to join every time, but sometimes I miss because of time lacking. Yes.
Yeah,
Thank you
and
very
we
much.
actually record
Yeah.
all the lecture, and we put it on the YouTube. So if you miss this one, you may see it later, all right, or see it anytime. So I will send the link to you again, Professor Narmaya, and hope you have a great day. Thank you.
Thank you, sir. Thank you
Yeah,
so
and
much.
please go ahead and enjoy your breakfast.
Yes, thank you, sir. Thank you so much. Okay,
Yeah,
see you.
and thank you
Bye-bye.
again for everyone.
Bye-bye.
And bye-bye now. Yeah.
Bye-bye.